Well, good morning, everyone. We are here today to highlight that tomorrow, Saturday, April 27th, is Drug Enforcement and National Prescription Drug Takeback Day. This Takeback Day is recognized twice a year in April and October, and it's really important to get rid of your unwanted and unused prescriptions because we have learned from the CDC that 13 to 18-year-olds are at very high risk for substance abuse disorders, and almost 20% of young people in that age group specifically report abusing prescription drugs. So this is an opportunity for families across the state to clean out their medicine cabinets and make sure that those prescription drugs are disposed in a safe way, because our young people are in crisis. 73% of our teens reported using drugs and alcohol as a way to feel calmer, less stressed, and mellow, and more relaxed. And 44% reported that they used drugs to stop worrying about problems that they had or try to forget bad memories. And 51% of those who said they did abuse drugs said they did that alone, which increases the risk of someone overdosing. So today we want to highlight that there is a real opportunity to take a look at your medicine cabinet. When's the last time you really did that? And check to see what's expired, what you're not using, and take those drugs and prescriptions to one of the sites, like right here at the East Hartford Police Department, to ensure that they are disposed of safely. East Hartford is one of the many communities across our state that's helping with Takeback Day, and we really appreciate the mayor and the work of East Hartford law enforcement and our DEA for helping us. I'll tell you that the last Takeback Day that we had here in Connecticut, we had participation from 94 law enforcement agencies across our state, and a total of 9,100 pounds or 4.6 tons of unwanted or expired household drugs were collected. Through our Take Back collection days, our state has collected a total of 174,000 pounds or 87 tons of unwanted prescription drugs. So if you want to check out where you can take prescription drugs back, you can check out the DEA website. You'll hear more about that in a minute. I also want to take a moment to thank our Connecticut National Guard for helping with Take Back Day. They routinely do drug prevention programs in schools. They also assist law enforcement agencies with Take Back Day and actually pick up large quantities of prescription drugs and take them to safe disposal sites. So we really appreciate our National Guard partners. And now I do want to say that this is an opportunity as well to get rid of expired EpiPens, patches, gels, medications, and liquids that are in and in tubes may not be collected, but please take whatever you have to your local police departments or drop-off sites. And we really appreciate all our partner agencies that you're going to hear from in a moment. And now it's my pleasure to introduce Connor Martin, Mayor of East Hartford. And Mayor, thank you so much for hosting today and for all your great work.
Thank you, Lieutenant Governor. And thank you, everybody, for joining us this morning. We are thrilled to be back again with this important partnership between the East Hartford Police Department in the East Hartford Health and Human Services Department for the DEA's National Prescription Drug Takeback Day. East Hartford's participation in Takeback Day reflects our commitment to our residents' safety and health, encouraging them and providing them with the resources to remove unneeded medication from their homes, decreasing the opportunity for medication misuse. The town of East Hartford is not immune to the drug overdose epidemic we're seeing across the United States. However, we can help our community safer and healthier by helping to prevent medication misuse and opioid addictions before they even start. Through participation in Takeback Day, as well as the permanent medication drop box we have installed here at the Public Safety Complex, which is on the first floor, we aim to support the health and safety of our community members because it is our residents and business owners that truly make East Hartford so special. Personally, I will speak on how important this day is, as even in my own family, there has been medication misuse, opioid addiction, opioid misuse that has resulted in a few tragedies. So speaking from a personal use, this day is extremely important for everyone to know how important it is to make sure that medication is not being misused so that you too don't lose a family member. Lastly, just want to thank our Lieutenant Governor Susan Bysiewicz for choosing to highlight the effort that East Hartford is making on this very important day. And with that, I will turn it over to our next speaker, David Lanzoni, who is the Assistant Special Agent in charge of the DEA's New England Field Division. Thank you. David?
Thank you very much, Mayor. Thank you. Yes, thank you very much. Thank you very much. I appreciate being here. It's a difficult act to follow the Lieutenant Governor and the Mayor. They basically said everything that I had prepared for myself to say today, but I am David Lanzoni. I'm the Assistant Special Agent in charge of the DEA here in Connecticut and Western Massachusetts. Tomorrow's event, held between the hours of 10 a.m. and 2 p.m., is an amazing opportunity for households to get rid of any unwanted, unneeded, and unnecessary prescription and or over-the-counter drugs. As you may be well aware, those drugs pose to be a gateway for young children in our communities to experiment and get their first taste of what could potentially become a very dangerous and slippery slope for them to live. On April 27th, between the hours of 10 a.m. and 2 p.m., at a variety of collection sites here within the state of Connecticut, you can come in with complete anonymity and drop off any of those unused over-the-counter and or prescription drugs. Unfortunately, at this time, we are unable to accept any sharps and or needles, but as the Lieutenant Governor said, there are plenty of collection boxes at plenty of the police departments and hospitals around the state of Connecticut to do so safely. I would like to let you know also that this is an event that we do 2 times a year, and the reason for that is we've had overwhelming success over the occasions that we have had this event. And I'm proud and happy to announce that over the times that we have done this, we've collected in excess of 9,000 tons of unwanted and unneeded prescription and over-the-counter medications. Outside of today and the event that we'll be holding again in October, please be advised that there are in excess of 17,000 drop-off sites across the country. So every day can be a drug take-back day. There's no need to keep unwanted and unnecessary or unused prescription and over-the-counter medications in your home. I'd like to say we'd like to see you tomorrow at one of our collection sites, and thank you so much for your continued support, and the DEA is pleased to be partnering up with the East Hartford Police Department. Thank you, Mayor, thank you, Lieutenant Governor, and thank you all for your time.
And could you please tell folks what the website is if they want to check where to drop off their drugs?
Yes, ma'am, I appreciate that. Yes, so the website has, you could go to DEA.gov, but the website that's specifically designed for the drug take back is DEA-take-back.com.
Great.
Thank you, Lieutenant Governor, appreciate it.
Thank you so
And
much.
at this time, I'm sorry.
Yep.
Please.
Thank you so much. We appreciate that. And it is my pleasure to bring up the Director of Health and Human Services in the city of East Hartford, Lawrence Burnson.
Thank you, Lieutenant Governor, and good afternoon. Drug take-back events like this that we're locally supporting are a very important component of intervening and reducing the risks and potential consequences of unintended use of leftover medications or medications that might be in a person's household that are no longer needed in use. Individuals may accidentally take those medications and have risks of unintentional falls or injuries, especially for our vulnerable populations like seniors. That can be a risk that can result in consequences such as injury and unintended hospitalizations and emergency department visits. Medications that are accidentally taken by other families or relative members, even if it's just accidental, can also lead to similar consequences of hospitalizations, and in more severe cases, unintended deaths from overdose. So it's very important for public health to support drug take-back events so we can try to minimize the risk by having medications that are left over in the household. In Connecticut, for example, with the most complete year of data when it comes to the most severe consequences of death, in 2022, there were approximately 1,400 unintended overdose deaths that occurred in the state. And East Hartford, as the mayor and other members here mentioned, are certainly not immune from that. We had about 24 deaths, unintended overdose deaths that occurred in East Hartford. So in addition to encouraging individuals to take the opportunity to dispose of medications that are no longer in use and need to be removed from the household, your health department will also be supporting this event tomorrow by having a public health nurse here available to help answer questions about safe disposal of medications, about recognizing the signs of overdose, and providing additional resources for families to use outside of this event. For example, we'll have a limited supply of naloxone available, so individuals that may be concerned about family members that are struggling with addiction or at risk of an overdose event, they can pick up a dose of naloxone and have that ready, so that way if an overdose were to happen, they can administer that and quickly provide an immediate relief while additional help is provided. We'll also have supplies of Deterra medication disposal packages, so that way if you happen to miss this day or just for later use because you might have other prescriptions in the household that are still currently used, pick up a Deterra pouch. That way you can use that to dispose of various medications, whether it be pills, capsules, liquid, creams, and then have those safely inactive on their active ingredients and then dispose of safely in the trash. So again, we highly encourage residents to take advantage of National Drug Takeback Day and take advantage of your health department resources by coming and speaking with us. Any questions you might have regarding medication safety, overdose prevention, and pick up the resources that we'll have available. And at this time, we'll have Chief of Police Matt Hawkins.
Good afternoon. First, I want to take the time to thank our Lieutenant Governor, Susan Bysiewicz, for putting this together. Why? Because this is a very important day, not for just the town of East Hartford, but across our communities in this nation. Drug Takeback Day. It's a great opportunity for the local, state, and federal government to strengthen our sense of responsibility to the communities that we serve each and every day. It's a necessary initiative that directly contributes to, as our health director said, health and public safety. Far too often, unused prescription drugs end up in the wrong hands. That's dangerous, and quite honestly, it can be tragic. Improper disposal, such as flushing prescriptions down the toilet or throwing them in the trash, also poses significant risks. It can lead to water pollution, harm to wildlife, even accidental ingestion by a child or a pet. For these, we've been doing these the last few years. We average over just under 47 pounds just in the town of East Hartford alone. And to me, that's a lot. And we need your help to bring more in of these unused products. In summary, the Drug Takeback Day is not just about disposing medication. It's also about protecting lives, promoting environmental stewardship, and building stronger, safer communities. Let's all play our part in this initiative. Thank you.
Thank you, Chief. Appreciate that. You heard the health director mention Deterra. So Deterra is a product that can be used to dispose safely of your prescription drugs. You mix your prescription drugs with this product and then you're able to dispose of it in the trash. And to talk about this is Kelly Juleson, who is the co-president of the Governor's Prevention Partnership, and she's going to talk about the availability of this fabulous product.
Thank you, Lieutenant Governor.
Sure.
Very much appreciate it. Hello, good afternoon, everyone. And just want to underscore the important points that we've heard here today. Tomorrow is such an important time to clean out your medicine cabinets, bring them to your local police department. If not tomorrow, go to your local take-back location, or you can come to us at the Governor's Prevention Partnership. We are distributing 50,000 of these pouches for free. You can visit our website, preventionct.org, and as the Lieutenant Governor said, you're able to actually, I'm going to show you quickly here what you do.
Show us.
You can very quickly take off the top. You're going to put in your liquids, your pills, or your patches or ointments, and there's a capacity on here. I'm going to pour into some old cough medicine of my children's that's expired. And we're going to add some water. Sorry, I should have been a little when we're ready here. And you can hear the chemical reaction, it sizzles a little bit in there, you're gonna seal it up. Those pouches are made of sugarcane and they can go directly in the household trash. So if anyone happened to get their hands on this medication, even if it has already gone into the pouches, it would be rendered inactive. So presenting no danger to an individual, or as the chief said, even to consider our pets as we throw things out. We just can't underscore the important actions that we can all take for prevention, for preventing the deaths. Last year in Connecticut, I believe there were 1,329 overdose deaths here in our state, and that we can take action. It's disposing of our medication. As caring adults, we can have the conversations with the young people in our lives around the dangers of substance misuse. It's actually, this is always so staggering, 50% less likely that a young person whose parent has talked to them about the dangers of drugs and alcohol that they're actually going to use. So we do have the power. We can take immediate action, whether it's tomorrow at Drug Takeback Day or every day in your home with a Drug Deterra pouch. Please visit us at preventionct.org to get yours for free, and we'll be happy to send those out. Thank you again, Lieutenant Governor, for having us and for bringing awareness to this important day.
Absolutely, and encourage people to check out this great product as well. So what we're gonna do is we're gonna take on-topic questions about Takeback Day from our media partners. I appreciate that you're here.
I just think people would be interested to know, so if the medicine doesn't go into that pouch, which renders it inactive, if it goes into the traditional waste stream, obviously the chief talked about some of the environmental concerns with that, but for all the medication that goes into those safe boxes where they get disposed, from there, does it get incinerated? What happens to it after that?
I'm gonna ask our DEA person to answer that, because it is, I do believe it's incinerated.
That is correct, yes,
Yep.
ma'am, yep. Thank you, Lieutenant Governor, that is correct. Yep, so everything that is collected here in the state of Connecticut with the assistance of the Connecticut National Guard, as the Lieutenant Governor said, is brought to a secure location where it is properly disposed of by incineration. That is correct.
And what are some of the, I guess, most common medications that people turn in, prescription and non-prescription?
Anything from over-the-counter expired Tylenol and Advil to cough syrup to Mucinex to some of the most severe, pain-fighing and thwarting drugs, whether it be Vicodin or OxyContin, fentanyl patches, whatever it may be. It runs the gamut, and what we try to emphasize, and I think the Lieutenant Governor did an outstanding job of saying, it doesn't matter what it is, get it out of your medicine cabinet and get it out of the house so it can be disposed of.
And I think it's really important to highlight that, unfortunately, a lot of us will just not look in the medicine cabinet, and a lot of us have expired prescriptions, but we know that years ago, doctors more frequently prescribed opioid products for even minor things like dental surgery, like getting your wisdom teeth out. And so there are a lot of households that have those very dangerous drugs that are habit forming and addictive. And we don't want anybody, I don't want those to fall into the hands of people who abuse them. So this is an opportunity to get all that stuff out of your medicine cabinets and bathrooms and get it safely disposed of.
And a lot of people too probably don't even have or use a formal medicine cabinet. I mean, I know people, they get their prescription drugs, they throw it in their top sock drawer, which if you have kids, it's probably not what you want to do.
Right, and you're absolutely right. A lot of people don't safely store their prescription drugs, which is another reason to take the opportunity and take all of those things out of your home, either by bringing it to a law enforcement agency that's helping with Takeback Day, or using this Deterra product, and you can just put it in your trash. Any other questions? All right, thank you all so much for coming. We appreciate it.